So, namaste everyone. I am Dr. Ankita Sawant, your physiotherapist. Welcome back to my channel Physio Vitals. And today I am going to discuss about knee exercises in order to avoid osteoarthritis. If you want to prevent surgeries, I am not here to guarantee you or assure you, or I'm not doing any kind of plagiarism against the knee surgeons. Okay, I have nothing to do with that, but I am just sharing my knowledge, my personal experience, clinical experience that I have been doing with my patients, and how the patients have been delayed. In few patients have delayed their surgeries, and few have, you know, few patients do not require surgery as per the orthopedic surgeon, knee orthopedic surgeon. So, osteoarthritis of the knee can be a debilitating condition, but with the right exercises, you can strengthen the joint and potentially delay or even avoid the need for surgery. Okay, not again, I'm saying this is not for everyone. Okay, so do not get the bias thing or misinformation that okay, she's saying then we'll do this, and if you don't get the result, that doesn't mean. Every person has different body type, their body weight, comorbid factors. So it's not a thumb rule that by doing that it is going to happen that only. There are many factors that we have to look into. Okay, but if the particular person or patient is in that particular checklist, then we can assure you after assessment that the surgery can be delayed or there is no need of any surgery. So this presentation will guide you through effective knee exercises and explain how they can help manage your osteoarthritis. So first we'll go through the anatomy. So the knee joint is one of the largest and most complex joint in the body, enabling a wide range of movement while supporting much of the body's weight. Its function as a hinge joint, allowing flexion extension, and is stabilized by a network of bones, ligaments, muscles, and cartilages. Okay, so here we'll break down again. I'll explain each and everything. So first, speaking of the bone, the femur, the upper part of the knee joint is formed by the lower end of the femur. Upper part of the knee joint is formed by the distal part of the femur, and the lower part of the knee joint is formed by the proximal part of the tibia mainly. So it has two rounded areas called the condyles, the medial and the lateral surface that meets the tibia. So femur has medial lateral condyle that meets the tibia bone. The tibia, or which is also known as the shin bone, the larger of the two bones in the lower leg, the tibia's upper end connects with the femur to form the main weight bearing portion of the knee. The larger of the two bones in the lower leg, the tibia's upper end connects with the femur. Tibia's upper end connects with the femur, which is proximal, tibia is distal. So tibia's upper end connects with the femur to form the main weight bearing portion of the knee. Okay. Now patella, which is also known as kneecap. So this small triangular bone sits at the front of the knee. It protects the joint and enhances the leverage of the quadriceps muscle in extending the knee. Then is fibula. Although it doesn't directly forms a part of knee joint, the fibula sits next to the tibia and helps stabilize the lower leg. It doesn't actually participate in the knee joint. Next, moving further to the cartilage. This articular cartilage, which is a smooth, slippery tissue covering the ends of the femur, tibia, and the back of the patella. A smooth, slippery tissue which covers the end of the femur, tibia, and the back of the patella. So it reduces the friction and allows for smooth movement in the joint. Then we have menisci. The knee has two crescent shaped menisci, the medial and the lateral menisci. Now, between the femur and they are located between the femur and tibia. Now, these cartilage structures acts as shock absorbers, providing cushioning and distributing weight evenly across the knee. So these are the natural shock absorbers of the body. Even in spine we have intervertebral discs. So all these things are meniscus and all sort of things are the shock absorbers of the body. As the weight exerts, they alter the weight so that there is no structural damage to the joints, which will impact in the functionality of the joint. Moving further to the ligaments now. So ligament in the knee are very strong bands of the tissue which connects the bone and provides the stability. Ligaments are basically for stability. Okay. So first we'll say anterior cruciate ligament. So it runs diagonally in center of the knee, preventing the tibia from sliding too far forward and stabilizing rotational movements. So ACL is a very important ligament, very prone to the injuries. Footballers are more prone. So it runs diagonally in the center of the knee, preventing the tibia from sliding too far forward and stabilizing the rotational movements. Now, likewise, we have posterior cruciate ligament, which is located behind the ACL. It prevents the tibia from sliding too far beyond under the uh, too far backward under the femur. So it prevents the tibia from sliding too far backward. Okay, slagging too far backward under the femur, slagging of tibia. There's a sign which we can appreciate if anyone has the torn ligament. Then we have medial and lateral collaterals. So medial collateral ligament runs along the inside of the knee, which stabilizes the joint by preventing it from bending inward. Likewise, lateral collateral ligament LCL located on the outer side of the knee, it stabilizes the joint by preventing it from bending outward. Now tendons. The quadriceps tendon, very important. Connects the quadriceps muscle at the front of the thigh to the patella, playing a crucial role in knee extension. Patellar tendon, which connects the patella to the tibia. Though technically a ligament, bone to bone connection, it's often called a tendon because of its involvement in muscle to bone connection, aiding in knee extension. Now, speaking of muscles, we saw quadriceps, a group of four muscles or the front of the thigh responsible for extending the knee. Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. The four group muscles. Together they are formed called as quadriceps muscles. Quad, four. Next is hamstring, which is located at posterior of the thigh. Okay, so back of the thigh, it is located. These muscles flex, which means bend the knee and work in opposition to the quadriceps. So quadriceps helps in extension, hamstring helps in knee flexion. Next we have gastrocnemius muscle. So it's a part of calf muscle. It also crosses the knee joint and helps in knee flexion. Next we have bursae. So bursa are the small fluid filled sac that reduces the friction between the tissues of the knee. So there are several bursas around the knee joint, including the prepatellar bursa in front of the kneecap, the infrapatellar bursa below the kneecap. Okay. Then joint capsule. The knee joint is surrounded by a capsule, a fibrous membrane that encloses the joint and contains synovial fluid. So this fluid lubricates the joint, reducing the friction and nourishing the cartilage. So together these components allow the knee joint to perform essential functions like walking, running, jumping and bending, while the ligaments and cartilage provide stability and support. So any damage or wear to these structures can lead to knee pain or dysfunctions, as seen in conditions like osteoarthritis and ligament injuries. Moving further to the understanding of osteoarthritis. So osteoarthritis is most common form of arthritis affecting millions of people worldwide. So it is a degenerative joint disease which is characterized by gradual breakdown of the cartilage. A flexible rubbery tissue that cushions the end of the bones in a joint. When the cartilage wears down, bones begin to rub directly against each other, leading to pain, swelling, stiffness, and reduced mobility. So, osteoarthritis can affect any joint but is most commonly found in knee, hip, hands, and spine. So, we'll see the key characteristics of the osteoarthritis. Degenerative cartilage. Over time, the cartilages in the affected joint begins to thin and wear away. Okay, degenerative changes. So this cartilage loss is gradual and worsens with age. Degenerative. Okay. Then bone changes. As cartilage wears away, bone begins to rub against each other, which may lead to the formation of bone spurs, osteophytes, which we see in the X-rays around the joint. So bony spurs or the osteophyte formations we can see appreciate on the X-rays. So bone spurs can cause additional pain and limit joint movement. Next, synovial fluid changes we can see in osteoarthritis. Synovial fluid, which lubricates the joint, may become less effective, resulting in increased joint friction and further cartilage damage. So basically friction is the main culprit. Because of weight bearing, reduced joint space, degenerative changes, friction, rubbing, osteophyte formation, synovial fluid changes, pain, stiffness, all that things. So joint inflammation now. So although osteoarthritis is primarily a mechanical degenerative condition, inflammation can occur, contributing to pain and swelling, especially during flare-ups. So symptoms of osteoarthritis often develop slowly and become more severe over time. Key symptoms include pain, the joint pain that worsens with activity or after period of inactivity. So when most of the physios, orthos, they advise you, anyone who is diagnosed with osteoarthritis, that you should be uh, reduce the activities like walking should be reduced, sitting on the ground cross-legged should be avoided. So pain, the joint pain can worsen the activity and after periods of inactivity. Then stiffness can occur. Though we are speaking of symptoms now. Pain, then stiffness. So joint stiffness, especially in the morning or after resting for a long period, usually lasting a short while. Okay, so joint stiffness, especially in the morning or after resting for a long period, usually lasting a short while. Then swelling. Swelling around the joint due to inflammation. Due to inflammation, there will be swelling. Then reduce range of motion. All these factors will reduce the range of motion. So decrease hoga flexibility or limited movements in the affected joint. Then grinding sensation will be there. A feeling or sound of grating while moving the joint due to bone friction, which is also known as crepitus in the medical terms. So causes and risk factors we'll see now. The exact cause of osteoarthritis is not fully understood, but several factors can increase the risk, which is age. Osteoarthritis is more common as people age, typically developing in people over 50. Then joint injuries. So previous joint injuries such as fracture or ligament tears can increase the risk of osteoarthritis in that joint. Anyone who has meniscal tear, ACL tear or any sort of fractures in the bone, they are more prone to develop osteoarthritis in their later stages of the life. Repetitive stresses. So repetitive stresses on the joint, often due to occupational activities or sports, can lead to cartilage wear. Then obesity, very important. Excess body weight puts additional stress on weight bearing joints, especially the knee and the hips, increases the risk of osteoarthritis. Next is genetic. A family history of osteoarthritis may increase susceptibility to the diseases. Okay. Then gender. Women are more likely than men to develop OA, particularly after age of 50. Okay, so we saw cartilage, inflammation, bony spurs. Then non-surgical interventions. So before that, we'll see diagnosis of the osteoarthritis. So medical history and symptoms, a thorough review of symptoms and any relevant risk factors should be done. Proper assessment, special tests, differential diagnosis, investigations, x-rays, MRIs, whatever you feel, you should be doing that. Then physical examination, checking for joint tenderness, swelling, range of motion, any skin changes, any comorbidities, any other physical problems or physical abnormalities. Then imaging tests. Likewise, I just mentioned X-rays, commonly used to identify cartilage loss, bony spurs, the osteophyte formations, and the joint space narrowing. MRI may be used for more detailed images of the cartilage and soft tissues. Lab tests. Very important, blood tests are not used to diagnose OA directly, but they can help rule out other types of arthritis. Sometimes joint fluids may be analyzed to rule out infections or other joint issues. So treatment for osteoarthritis, while there is no cure for OA, various treatments now see. It will, you must be thinking I am giving a contradictory statement. There is no cure for OA, but there is prevention for OA, and that prevention I am speaking of now. So lifestyle modification we can do, weight management. In that weight management, losing excess weight, reducing stress on weight bearing joints potentially slows the OA progression. Then exercise. Low impact exercise like walking, swimming or cycling helps strengthen the muscle around the joint, improving stability and reducing the pain. Next, physical therapy. Physiotherapy and occupational therapy is required. So physiotherapy can teach specific exercises to strengthen muscles and increase flexibility, while occupational therapy can offer strategies to protect joint during daily activities. Medications for pain relief. So acetaminophen or NSAIDs can help alleviate pain. Topical treatments, creams and ointments containing NSAIDs and capsaicin or capsaicin can be applied over to the skin over the affected joint. Injections, corticosteroid injections can reduce inflammation and pain, while hyaluronic acid injections can supplement the joint's natural lubrication. Assistive devices. So devices like braces, orthotics, skates or shoe inserts can help support and protect the joints. Then lastly we can say surgical option, joint repair or replacement. So when osteoarthritis is in its severe stage, of which affects mobility and quality of life, joint repair, realignment or replacement surgery such as knee or hip replacements, TKR or THR may be considered. So preventing strategies, while OA cannot always be prevented, mild to moderate cases we can prevent it. In severe we need surgeries. So certain strategies may help reduce the risk or delayed onset. Regular exercises, strengthening muscles around the joint, providing better support and reducing strain, avoiding joint overuse, minimizing repetitive stress activities that puts pressure on the same joint. Then proper posture. Posture is really important, and body mechanics. So good posture can reduce joint stress, and lifting or bending with proper techniques can help prevent injuries. Maintaining a healthy weight reduces excess pressure on weight bearing joints. Okay, so that was all about exercise, weight management, pain relief, physiotherapy. Now, very important part we are going to cover of this lecture is exercises to strengthen the knee muscles. So here are some knee exercises that can help strengthen and support the joint, potentially reducing the pain and delaying or avoiding surgeries for osteoarthritis. So these exercises target the muscles around the knee to improve its stability, mobility and alignment, which can alleviate stress on the joint. So see how important exercises are. So always consult a healthcare provider, any physio which in your area. Consult, do a proper assessment. That physio will provide you the exercises. I'll going to cover the general exercises. Okay, this is general exercises which I am going to teach the students or viewers. So quadriceps strengthening exercise, straight leg raises, SLR. Lie on your back, one leg bent and the other leg straight. Tighten the muscle on the front of your thigh, quadriceps muscle of the straight leg, and lift it around 6 inches off the ground. Hold it for few seconds. See, first we should strengthen. So repetition should be done. When we are speaking of endurance, then hold should be there. First, to improve strength, always repetitions. To improve endurance, you should hold. So 10 repetitions of SLR, 3 sets. Okay? So do it 2 to 3 sets, 10 to 15 repetition of each leg. SLR should be done. Then quad sets. Sit or lie down with your leg extended. Then tighten the quadriceps muscle without moving the leg. Hold for 5 seconds, then release it. This is also called as static quads. You can place a towel roll beneath the knee, extend the knee, place it beneath the knee and press the knee onto that towel and hold it. Hold the press for 10 to 5 to 10 seconds, for 10-15 seconds. Repeat this set 3 times. Then we'll do hamstring strengthening. This was all SLR and static quads we did for quadriceps strengthening. For hamstring strengthening, hamstring is a muscle which is back of the thigh. So stand with your feet hip width apart and hold onto the chair or the wall for balance. So bend one knee, bringing your heel towards your glutes or the buttock muscle and hold for few seconds before lowering. Perform 2 to 3 sets of 10 to 15 repetitions. So this will be hamstring curls. In standing, you just have to bend the knee and straight, bend the knee and straight. Then calf muscles. For that, you need to do heel raises. Stand and hold onto a chair for support. Slowly rise your heel off the ground, coming on to your toes. Then slowly lower it down. So repeat 10 to 15, 2 to 3 sets. Then we'll speak of hip and gluteal strengthening. Bridging exercise. Lie on your back with knees bent and feet flat on the floor. Lift your hip towards the ceiling while squeezing your glutes or the buttock muscles. Hold for a few seconds and lower it down. Bridging muscle is basically forming a bridge. So 2 to 3 sets, 10 to 15 repetition. Then clamshells. Lie on one side of the knee, bend, one side with knee bends, keeping your feet together. Lift your top knee away from the bottom knee. Clamshell, like your side lying position, you're bending the knee and the upper knee you are lifting it up and down. That is clamshell. You can do first repetition, then we can do the holds. Then we can use resistance as well. It's the latest part. 2 to 3 sets, 10 to 15 repetitions on each side. Range of motion flexibility. Heel slides we should be doing. Lie on your back, straight the legs, bend the knee, straight the legs, bend straight, 10 to 15 repetitions per leg. Seated knee flexion stretches. Sit on a chair, extend one leg straight out and gently bend your knee to bring your foot back towards the chair. Hold for a few seconds, then release. Low impact. Now we'll speak of low impact aerobic exercises. Stationary cycle we can do. Cycling. This low impact exercise can help maintain knee mobility and strengthen muscles without high joint impact. Swimming or water aerobics. Water reduces joint stress while providing resistance for strengthening. Balance and stability now. Single leg standing. Stand on one leg and hold for 20 to 30 seconds. You can increase the difficulty but not holding onto a support. So single leg stand, I don't need to describe that how to do it. The word itself suggests says it all. Stand on one leg to 20 to 30 seconds. Toe taps. Stand on one leg and tap your other foot forward, sideways, backward, return it to the center each time. So aim for 3 to 4 times a week to see benefits. Consistency is needed. If you are lazy, I'm sorry, it's not going to work. Consistency, discipline is needed, really needed. If you want to really cure yourself, exercise will do wonders. No need of any kind of extra medications. Uh, if you are disciplined enough, you are regularly exercising, meditating, exercises will do wonder. So start with low intensity versions and progress as tolerated. So if any exercises causes sharp or lasting pain, stop and consult the professional, any physio around you. So these were the exercise when done consistently can strengthen the knee support. So that was all about the proper techniques. Now we'll see the proper techniques. Knee alignment. Keep your knee aligned with your toes to avoid undue stresses on the joint. Foot position is really important. Maintain a stable shoulder width stance with your feet pointing slightly outwards. Proper posture. Standing up straight and engage your core to support your spine and knee. Then range of motion. Perform exercises through a full comfortable range of motion to maximize the benefit. So how these exercise can delay or prevent surgeries? So once the muscles around any joint has been strengthened, strengthening the muscle around the knee joint can make pressure off the joint and reduce wear and tear. So not just knee but any other joint, if we strengthen the muscles around whichever joint, then we can reduce the pressure. We can reduce the damage to that particular area. That was about strengthening. Then improving flexibility. Increased flexibility improves range of motion, reduces the risk of further joint damage. Reduce pain and inflammation. By managing pain and inflammation, these exercises can improve function and delay the need of surgery. So thank you for your time and attention. I hope this video was insightful, knowledgeable for y'all. And I think I have said enough. We can stop. God bless you all.